Today, Health and Human Services Secretary Robert F. Kennedy Jr. said the outbreak of a severe intestinal illness is under control, and he said the source has been identified. The FDA still believes Taylor Farms is the source of the contaminated lettuce, despite a sample that it said inaccurately tested positive, creating lots of consumer confusion. Last week, that company, Taylor Farms, voluntarily recalled iceberg lettuce from a farm in central Mexico. The CDC says more than 1,600 people have been sickened, but that number could be much closer to 7,000 because CDC data often, as we have learned, lags behind reporting from state health departments. Former FDA Commissioner Dr. Robert Califf joins me now. Doctor, it's great to have you here. Big question. How do you assess the federal response thus far?
Well, I know the people at FDA have been working really hard, and I do think, the epidemiologic evidence that they've gathered really points in the direction that I think you reported quite accurately, the Taylor Farms, if you look at all that they've said. I do worry, though, that, the FDA is depleted, so is the Agriculture Department, so is the CDC. And, it makes you worry that the response could always be more forceful and not impeding other work that needs to get done. When something like this happens, you end up with all hands on deck, and then you wonder what else is not getting done across the agency. But basically, I think they've done their job. And of course, we always look for ways to make it better.
Robert F. Kennedy Jr. said, all the cuts that we made, they were just for redundancies. They haven't affected anything on testing or surveillance or monitoring. Should the American public be willing to accept that explanation?
No, to be blunt, no. I mean, that's just not true. So I'm sure that over time, the full effect of Doge will be analyzed by many people. But I think within HHS and FDA, of course, I left. I was a Obama and then a Biden appointee, and so I was not there when the cuts were made. But I sure know a lot of people with a lot of talent who were cut with no real assessment of what their jobs were or what needed to be done. There's a big example people are talking about today. There was a joint committee between FDA and Agriculture Department that focused on the science of infections in agriculture, exactly what this problem is, and it was disbanded for no apparent reason. And they were in the middle of a lot of important work that would have informed how to proceed forward. So, no, I don't think that's a accurate assessment, and we'll see when the dust settles.
Doctor, I've read that symptoms can arrive in 2 days or as many as 12 days. So it's somewhat hard to get people to remember what they consumed, where they consumed it if it was 2 weeks ago.
That's right. And that's the problem with this particular parasite, which is a parasite. It gets into the intestine, it sort of roots in there and takes up habitat, and it takes a few days or even as long as 2 or 3 weeks. And so, in terms of pinpointing where the source was, that's a difficulty, but it's also a difficulty knowing when you're out of danger. When is it that this is over? Because people who got in, let's say, ate some lettuce 2 days ago, they wouldn't get sick probably for another couple of weeks. So we still got a ways to go here to get this sorted out. Should also point out, and this was noted in the FDA communications, every summer there's some cyclospora. I mean, this isn't a parasite that's abundant in nature. And so we have these small outbreaks every year, not a big one like this. This is quite unusual. But there are probably some other small outbreaks that are going on simultaneously, like would happen every summer. So we got to keep that in mind, too, as we look at the numbers.
Dr. Robert Califf, former FDA Commissioner, I appreciate your time and expertise very much. Thank you, sir.
Thanks. Good to be with you.